Hello, my name is Dr. Sharon Cobb. In collaboration with my study team from the Charles R. Drew University of Medicine and Science, we would like to specifically talk today about colorectal cancer screening among older African Americans. What precipitated this study was that when we examined the literature, we found that African Americans have higher rates of colorectal cancer compared to non-Hispanic whites. Specifically, they are less likely to follow up with their healthcare providers regarding abnormal findings of colorectal cancer screenings. Therefore, we aim to examine and identify related factors with providers' recommendation in obtaining a sigmoidoscopy or colonoscopy test among older African Americans in South Los Angeles, California. In regards to our methods, we did a cross-sectional study and we recruited and enrolled 740 older African-American residents residing in the South Los Angeles area. Specifically, we measured physical and mental health status, healthcare usage and access, as well as other variables, including number of chronic conditions. For our analyses, we looked at descriptive and multivariate logistic regression tests. When focusing on our results, 1 out of 3 participants reported that they had never received a sigmoidoscopy or a colonoscopy for their colorectal cancer screening. More than 31% indicated that their providers never suggested colorectal cancer screening or testing. Moreover, participants who indicated that their providers recommended a sigmoidoscopy or a colonoscopy were almost 49 times more likely to obtain it compared to their counterparts who were not advised to have these procedures or screening tests. Additionally, we found that African American men were significantly less likely than women to receive recommendations from their providers for these tests. When looking at the factors that were associated with obtaining a sigmoidoscopy or a colonoscopy test, we found these factors, which included living arrangement, having a membership with HMO, which is also known as a health maintenance organization, the number of providers, satisfaction with access to care and the quality of care, depressive symptoms, and gastrointestinal conditions or GI disorder. So with moving into our discussion, we found that there are disparities in 4 primary factors, which include the patients, healthcare providers, the healthcare system, and society. Moreover, providers who encourage patients for colorectal cancer screening were more likely to be screened. Additionally, we need to focus on culturally appropriate messaging and public campaigns to educate and encourage healthcare providers and patients, as well as lower awareness and access to colorectal screening, which can establish the need for community-based and cost-effective interventions. Thank you.